if someone comes to you saying that I have experienced gender-based violence in whatever form, the best thing that you can do is to say, like, I believe you, like, period, end of sentence. You don't need to, no qualifiers to that sentence. I believe you, and then to work with that person to figure out what they might want to do.
This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Please note that this episode will discuss issues around violence and trauma and may contain sensitive or triggering content for some people. If you or someone you know has been impacted by violence of any kind, know that you are not alone. Please use your discretion when listening to this content and connect to the appropriate supports as needed. For our listeners in Canada, you can visit endingviolencecanada.org/getinhelp or use the other resources in the show notes. In the previous episode, Gordon, Ben, and Linda welcomed Lindsay Belvedere, a senior policy advisor, to the podcast to talk about the different types of gender-based violence and its impact on women and girls in Canada. In the second part of their discussion, they shift the conversation to highlight the levels of prevention, how COVID-19 has exacerbated the burden of gender-based violence, some policy options, and some actions we can take to create safer environments. This is where they left off.
This is heavy, but we'll transition this to go in the direction of what can we do? The situation's happening. There are a variety of different factors at play that cause what we see today. We have to have multifaceted, a systems thinking approach, if you will, to address gender-based violence at all different levels in terms of levels of prevention. So in general, there are usually three categories or three levels of prevention that we focus on in the context of public health. So you're going to be primarily focusing on primary prevention, but I just wanted to define tertiary prevention and secondary prevention first.
I'm going to actually start with tertiary prevention because that is where most of our conversation has been so far. And so tertiary prevention is essentially reducing the long-term consequences of gender-based violence, or what with other health issues we might think of that as treatment. So in the context of what we've been discussing, this would include things like access to shelters, access to counseling services for anyone who is involved with gender-based violence, as well as what we've already talked about, the better training for police and judges to ensure that victims aren't re-traumatized through the judicial process, and so that they'll be more likely to make a report. One other thing is also access to sexual assault evidence kits, and access to those services within our hospitals, particularly in rural areas, because lack of access to those services is also something that will, keep people from having the evidence collected, which then will also make it much more difficult to move forward with a case if you do decide to report it to the police later. So that is also a really important one.
That's important too, because if someone or if a woman is experiencing violence, they almost need to know that if they were to come forward with it, they could do so safely, and then the perpetrator will be held accountable. So those evidence kits that you mentioned, if there's reporting and then there's no legal arm to prosecute the person that's being, accused, there's that fear of they're gonna get mad at me and we're gonna go home and live in the same home. So I can't overstate how important that evidence piece is. As much as it puts burden on the women or girls experiencing violence, that this is a tool that could help them ultimately feel safe in knowing that if there is a report made and evidence is collected, because ultimately that's what the courts apparently want, that the person who committed those acts of violence can be held accountable.
A few thoughts on that. One, it's also not just about the collecting the evidence, but making sure the evidence is processed. I'm not sure how big of an issue this is in Canada, but I know in the States over the last couple of years there's been a lot of news reporting on sexual assault evidence kits that have gone unprocessed. Like there's like warehouses full of thousands of them that were never processed. And so a lot of police departments in the States are now going through the process of now going through that evidence and actually, running the DNA tests or whatever they need to do, and leading to convictions, particularly in cases where, sexual assault cases where the woman may not know her perpetrator. That is particularly important. So that is one thing that's happening. And then I guess speaking in Canada, there is a lot of work being done right now to ensure better access to sexual assault evidence kits. But one thing that is really important that's happening across the country is trying to disassociate collection of evidence from reporting. So, helping women to go to their hospital or their health center to get the evidence collected, but to let them know, or to have a program in place where it doesn't mean they have to turn the evidence over to police right away, but that it can go into storage if they choose for most places is up to a year. And then they have that year to decide if they do want to move forward with actually pressing charges. And so that's one thing that's being done, just to give women their agency back, particularly in sexual assault situations where, that's a situation where your agency has been taken from you, to do everything that we can to give them their agency back so they can make the decision to move forward, but also to make sure the evidence is collected in a timely manner so that if they do want to move forward, like that evidence hasn't been lost.
Awesome. That's some good insight right there. So secondary prevention is more of the immediate impacts of violence. Am I getting that right? Yeah.
So I guess when I was thinking about this, I was thinking more around reducing the impact of gender-based violence that has already occurred. And we know with other public health issues, that's typically what we would call screening. And so there are screening tools that can be used by schools and healthcare providers to screen for gender-based violence, which is, could be particularly important. I'm thinking, kids are in schools with teachers all day long. And so, making sure that teachers have the training that they need to be able to look for signs of violence in the students that they are teaching. And also with healthcare providers, making sure that they know what to look for and the types of questions to ask for, women who might be presenting at a doctor's office or in the emergency room, to be able to screen for gender-based violence. So that is something that's really important. And then the other thing that I thought of was just around making sure that those who have been victimized by gender-based violence know what tools and resources there are that are available to them, and then making sure those things are, embedded in places where they regularly access information. So, going back to Linda's example about newcomers, making sure, that they're provided with that information as part of their settlement program, whether or not they need it, but just making sure that information is provided to everybody, or more generally, just, public awareness to make people aware of, these are the resources that are available to you if you are experiencing this thing, and particularly around helplines. These helplines are available to you, and now a lot of them have gone to also offer text and chat-based help, and so you don't have to make a phone call, because obviously not everybody is going to be comfortable picking up the phone and actually talking to somebody. But that's something that's being done to.
An example that comes to mind is when you go into bathrooms, like women's bathrooms, and you see those posters on the mirror or something, or there's bookmarks with helplines where people can go to seek help.
Another example I was thinking of is when they go see their physician and they fill out a report or any screening measures, and it's use black pen if everything's okay, use a red pen if you're experiencing, gender-based violence. So I thought that was really interesting. And then that's always in a private scenario, right? Or a private clinician setting.
Yeah, I think the other thing that we've also seen since Zoom has become a thing over the last year and people have had to stay home is the promotion of different types of hand signals that people can do on camera. So if I'm remembering right, I think the main one is like putting your thumb into your palm and then like folding your forefingers over your thumb, to let people know that, I am not in a safe situation in my home. Like, reach out to me. I need help, whatever it might be. So I think people are getting, innovative with ways of letting people know that they can seek help.
I saw that there was an initiative where someone had created an app where women can order like beauty products, but if they ask for it to be delivered to their home, that means they want someone to come and check. They need a wellness check because they're not okay. Or depending on what items they add to their cart, it corresponds to what situations they're experiencing. So it's a way to seek help without openly showing that you're seeking help in case it's not safe to do so in your environment. So I thought that was a really cool innovation in light of, the pandemic and things that we're experiencing. People can't seek help. So yeah, maybe that also falls under secondary prevention.
That is really cool. I've not heard of that, but I love that idea. I'll have to go look it up after we're done.
Yeah, I've also seen there's like stations set up in like pharmacies or grocery stores now because the problem was or is that a lot of places have closed as a result of, and we'll get into COVID, the impacts of COVID-19 in a minute, but the pharmacies and grocery stores are often considered essential and therefore they are open typically. So leveraging those infrastructures to have safe spaces in there where there can be some communication about safety or unsafety. I've seen that being done too. So it's good that we're getting creative and hopefully the perpetrators of the abuse or violence are not privy to all of those methods, because that's another safety concern as well if they're aware of all those different methods.
Yeah.
So primary prevention, which is typically the gold standard of public health. Tertiary and secondary are important because people are at different stages in their life course, and there needs to be supports out there for people who already experience different types of violence. But when we're looking at for long-term sustained change, there's no better place to start than primary prevention. So let's talk about primary prevention. Lindsay, I'll throw it over to you.
Okay, sure. So primary prevention seeks to prevent gender-based violence before it ever occurs. So this is what we typically refer to as our upstream approach to addressing a public health problem. And it is the thing that I am most excited about, but also I think the thing where the greatest gaps remain in this prevention spectrum that we've been talking about. So primary prevention seeks to address the root causes of gender-based violence. So we know that gender inequality is consistently recognized as a root cause of all forms of gender-based violence. And then other social inequalities exist that might compound that abuse and violence, such as racism, homophobia, classism, ageism, ableism, religious persecution, as well as other risk factors, such as lower levels of education, history of exposure to violence and abuse, which we've already talked about, poor mental health or unaddressed mental health needs, attitudes in society that accept violence, male privilege, and women's subordinate status generally. And then specifically when it comes to Indigenous peoples, their experience with settler colonialism, institutionalized violence, and intergenerational trauma. So those are all, I guess, really broadly root causes of gender-based violence. And also we know that many of those things are, what we in public health call our classic social determinants of health. And so for me, it was really making that connection between, the causes of gender-based violence are the social determinants of health. And so this is a public health issue. And a lot of people, I would say generally that connection isn't being made in a lot of places. So I think, when we frame it like that, that's where we can, that's really important, and it will help us to better address gender-based violence. So I guess in terms of interventions, there's a few things that I came up with, and again, I feel like this is where our biggest gaps are gaps in knowledge and gaps in what is effective. But some things that are being used across the country are any efforts to engage men and boys in preventing and ending gender-based violence. So this could include teaching healthy masculinity, engaging men and boys in violence prevention strategies, rehabilitation for men who have used violence, and also teaching consent and healthy relationships. And so a lot of these programs now are starting to target adolescents, as well as university and college students. So that is, where a lot of that work is happening. And then really, honestly, any effort to address any of the social inequities I listed as root causes of gender-based violence will help to reduce gender-based violence. Yeah, and so to me, that's, taking a step back and taking that public health approach to addressing the problem. And hopefully, if we're going to address, for example, like if we're going to address racism or work on anti-racist actions and becoming anti-racist, then, that's hopefully will not only lead to better outcomes for Black, Indigenous people of color in this country, but will generally lead to reducing racist gender-based violence. It's really understanding that everything is interconnected, and that all of our efforts and interventions will, hopefully lead to addressing gender-based violence, as well as other outcomes and societal injustices that need to be addressed.
I really like how you emphasize those interconnections, because then it highlights, like, if we know by understanding this problem as something that's interconnected, then we know that our interventions are not just isolated to one sector. Like, everybody can positively influence reducing gender-based violence because its source is so multifactorial. So when we talk about schools, for example, teachers have a role to play in the media, or in like public health and education. So I think that often we might think, like, that's something we don't talk about, we don't have to care about that if if you work in something that you might think is not related, but actually what you've been describing is that this is a problem that's connected.
Yeah, I agree. So prior to my position with the Violence Against Women and Girls team, I was an intern with the Addiction and Mental Health branch at Alberta Health, and I was part of an internship program that had interns across the government in multiple different departments. And, coming into this job with from a public health background, it was like, okay, well, you work in the Department of Transportation, and you work in education, and you work in the environment. And so, like, you all really work for public health. That's really what it is. But I think so often people, the connections aren't being made.
Yeah.
Like, how does my work on better access to transportation, like, does that impact gender-based violence? For example, like, harassment is really common on public transportation. Also, we need to have good transportation to ensure that women can get to shelters. And so I think it's taking a step back and understanding how every sector is interconnected on, it needs to be working towards addressing gender-based violence, even if it's not directly.
Yes.
Their work has an impact.
Yes.
And it's the same thing with any public health issue that I'm sure you've talked about on this podcast. I hope that explained it a little better.
This is why we need people like you in government. So we're glad that you're doing the work that you do.
Yeah,
Thank
and
you.
Just to cap it off too, those are some really great points. But there's also this, in terms of target population, you talked about a little bit about target settings, the target population. So we have women and girls disproportionately affected by violence, and then we have men and boys who are disproportionately committing acts of violence, and then we have the different stages in life, of course, whether it's youth and adults. So you have to have intervention hitting on all those levels, different populations, as well as having interventions to intervene at the youth level. I know, Lindsay, you mentioned that there was like date violence, and I think some of those youth programming focus around addressing date related violence, and then on the intimate partner violence side, the older adults. So I think given that it's a multifaceted issue, you have to have different levels of prevention and then different types of interventions within each prevention level. So I couldn't have said it better myself. So thanks.
It's complicated.
Complicated.
Yeah.
Complicated. Wicked problem, as they say in public health. Yeah. And then compounded on top of that, there's a pandemic happening right now called COVID-19. If you haven't already heard of it, and COVID-19 has put a strain on this same issue that we've been talking about. We know that there's increasing call volumes to a lot of these helplines. We know that there's increased calls to police about domestic violence related issues. So the issue was already something that deserved a lot of attention, and even more so now because of COVID-19. So what are some of those unintended negative consequences of COVID-19, given that a lot of what has happened with COVID-19 has resulted in, stay-at-home orders, lockdowns, shutdowns, job losses, and then, these realities, even though they're done with the intention of stopping the spread of COVID-19 in the pandemic, there's, secondary consequences which are not very good in the case of gender-based violence.
Okay, sure. So we know, based on past experience with different crises, that gender-based violence is a predictable and consistent side effect of economic, epidemiological, environmental crises, such as COVID-19. COVID-19 falls into all three of those things. Even if evidence of increased gender-based violence doesn't surface immediately, so it might not be immediately apparent. But as we've seen throughout the pandemic has exacerbated existing inequalities, and gender-based violence is just another one of those inequalities that has been exacerbated. And so specifically when it comes, I guess one of the biggest impacts is that it has limited opportunities for people to seek help. And so, for example, many people have lost access to family and friends who might be, their supports. They've lost access to daily trips that they were doing, such as trips to school or the grocery store, or wherever it might be that might give them an opportunity to be out of the house to go and seek help. And then also increased difficulty with accessing phone and online supports, particularly if your abuser is home with you all the time. You may not have that private space to access those supports. And hopefully as things are starting to open up again, things are getting a little bit better, but that's likely not the case.
Right.
And I know in some places they did see an initial decrease in people trying to access help services, and then it went back up in terms of people trying to access shelters and helplines. And at least in Alberta, and I've heard this anecdotally and from other places across the country, our family violence info line and our one line for sexual violence both have experienced increasing number of calls since the start of the pandemic. And I don't think that rate has changed. And I know Alberta has, experienced a couple of natural disasters in recent years, the floods from 2013, as well as the Fort McMurray fire. And both of those led to increased rates of gender-based violence following those things that stuck around for a couple of years, even after the crisis was over. And so even after, COVID-19 is resolved, it's likely that the rates of gender-based violence will continue to stay elevated. Another thing that's important is that, I talked about earlier how gender-based violence is generally underreported to police, but even still, police services across the country are reporting either an increasing number of calls, or if those calls aren't increasing, many times the severity, the nature of the severity of the call that they're responding to has increased since the start of the pandemic, particularly related to domestic violence calls. And, keeping in mind that these calls are lower than what's actually happening in the community. The rates of the community are going to be higher than the number of calls. Another thing that's happened is, initially our shelter system was not really set up to accommodate social distancing. And so I know for the sector that has been something that they've had to adjust to, implementing public health measures within their facilities to ensure that everybody stays safe. So that's been really important. And then maybe one other thing that has happened, I know we haven't really talked very much about sexual harassment in our discussion, but I guess two things of note, that people are reporting that workplace sexual harassment has just shifted into online settings. So it didn't disappear with people not being in the physical workplace, but it has just gone online. And then the other thing with that, and this was from a news article that I read, but someone wrote about their experience with sexual harassment and how, they had frequently experienced sexual harassment prior to the pandemic. And they thought like, oh, now that I'm going to cover my face and no one's going to see what I look like, maybe that will, mean that I won't get harassed anymore. And in this woman's experience, that was not the case. Like, she was still continuing to be harassed. And like, really, the thing that we can learn from that, which we know to be true, is that harassment doesn't actually have anything to do with what someone looks like or what they're wearing. But it is about gender inequality and that the imbalance in power. And so, the harassment has continued, even though we haven't been seeing each other in the same way or seeing each other as often. It's just shifted into different spaces and it looks a little different, but it's still there.
Wow. And I was listening to on that point, I was listening to the Canadian Women's Foundation podcast. I think it's All Right Now What or something like that. Very good podcast. And that was part of the problem too that they mentioned, because we're in a very economically strained situation as well. Many women fear losing their jobs and then are potentially less likely to report things that could cost them their job if they perceive that the person who was, whether it's committing sexual harassment or any sort of thing, especially it's that power imbalance exists, and then losing your job when you most need it. So I think that also contributes to the underreporting, if you will, because there's the perceived idea that, and it's a real situation too. I'm sure many women have lost their jobs for standing up for what was right and what has happened to them, and that's a real issue as well, especially during this pandemic.
For sure. And I think that goes back to, I know we talked about the need for reform within the criminal justice system, but in the workplace, like, your criminal justice system is your human resources team or your manager or whoever that might be. And so ensuring that, it's really important that we ensure that workplaces have good policies and that they follow those policies. And so that someone, a woman can come forward and report sexual harassment and again, be believed, and then have appropriate action taken.
Right.
Because that is, lacking in a lot of spaces.
Yeah, that's a good point. If you just think of just, it's likely that there's usually in a workplace, there's more than one people that are affected by, sexual harassment. So, and there could be relationships there where the people affected by sexual harassment come together and share their stories. And then if one goes forward and the appropriate action is not taken, that will likely discourage the second one. So they have to, in terms of that HR piece, they have to think of treating every example with the right amount of respect, because it will encourage others to come forward if that's their reality as well. And I think that can't be understated as well.
Yeah, for sure. I think that's, again, what we've seen with a lot of these really high-profile Me Too cases, against, especially with what's been happening in Hollywood. You know, one person has come forward, and then lots of others have come forward and said, yeah, this is something that I have also experienced, and that it's not just a one-time incident.
You know, we've talked a lot about the issue of gender-based violence, the different programs and supports that are available in the different levels. And we typically, you know, in terms of gender-based violence, you know, grassroots organizations working on the front lines to address violence against women and children, they're essential for helping create safer communities, especially at that tertiary prevention level. You know, but Lindsay, and we know you're very passionate about the upstream approaches to supplement what's already going on with the tertiary and secondary levels of prevention. So I wanted to talk a little bit about some, I guess they call it non-pragmatic approaches or policy options. And one thing front of center in my mind is there's always a discussion around increasing the minimum wage, for example. And we know that from what you touched on previously, a risk factor of gender-based violence, there's a financial security or insecurity component of it. So it stands to reason then, if there's more empowerment financially, that women can be more independent and have safer spaces for themselves and their children. So I know there's a lot of misconceptions about increasing the minimum wage. A lot of people think that it's teenagers who work high school jobs that are the ones that would be or part-timers that stand the most to gain from an increase in minimum wage. But the reality is, based on a stat I found from the Economic Policy Institute in the United States, that women account for 60% of the people that get the minimum wage. So, you know, it stands to reason then, by increasing the minimum wage, we would disproportionately help women to become financially closer, to have some financial independence. So just what are some thoughts on this policy option or some other policy options that you're aware of?
Yeah, I just fully agree with that. I know that's not something that's like conventionally discussed when we talk about minimum wage. But again, like anything that we do to lift someone out of poverty is going to give them more choices, right? And, you know, when we think of women who might be in an abusive relationship, you know, finances is a big reason that someone might choose to stay in a relationship that is not healthy. And so if we can give people, you know, the option to leave because they don't have to worry about their finances, then I think that's really important. The other thing that I thought of while you were talking I know Alberta has implemented this, and I know BC recently implemented this, and I don't know if it's in any other provinces in Canada, but Alberta has a 2-week domestic violence leave that is like mandated by law that every employer needs to provide. And I think it's unpaid, 2 weeks unpaid leave, but it's your job protected leave, right? So if you are in a situation where, you know, you have to leave a relationship, and, you know, part of that might be like you have to find somewhere else to live, or you have to move, or whatever it might be, your employer is required to give you, in Alberta at least, and now in British Columbia, they're required to give you 10 days of job protected leave to be able to deal with whatever you need to deal with. And so that's something, you know, making sure that workplaces are more friendly to just in general to the things that people have going on outside of the workplace is really important. And so that's one thing that has been done.
I was thinking how you had mentioned, Lindsay, you know, in Alberta when we had the Fort McMurray fires and things like that, and even in other readings prior to this, how a crisis is a risk factor for gender-based violence. So I was thinking, why does that happen? And, you know, I'm not a scientist of human behavior, but my first thoughts is that when people are stressed, we just tend to seek out somebody who we have like a perceived power imbalance, and we like take our stress out on other people. And so I wonder if things like emotional literacy and mindfulness and emphasizing those skills early on, and I know, when I was in kindergarten, we didn't have things like that, but I wonder if emphasizing those programs in childhood could help to reduce the risk of things like gender-based violence later on, and even, talking about your feelings. What do you do when you're stressed? Are you self-aware of yourself getting activated? Do you know how to pause, take a breath, seek outside help? Do you feel safe to talk about your emotions? I think that type of literacy is important, and our culture in general, we don't talk about our emotions. And I think that perhaps building that into, our education system, our homes, even other programs, that could really see a long-term benefit.
Yeah, I for sure agree with that. And I think that's, I talked a little bit earlier about work to engage men and boys, particularly around teaching healthy masculinities. And I think everything that you've just said is falls right into that bucket of things. Because, in general, men and boys are taught from a young age, not to show emotion, not to, being vulnerable is a sign of weakness, not to seek help, suck it up and be a man attitude. And that's actually really harmful. And so, if we can address those things at a young age and teach people, how to seek help when they should be seeking help, and that it's okay to, be vulnerable and express your emotions. I think that, that is a really helpful approach that, we need to do more of. And I think, when we bring that back to a policy approach, then I think we need to think about how that is something that needs to be taught universally. Because in Alberta at least, there are programs that are working with teenage boys, but they're not necessarily programs that are found in every school, every community, at every age. And a lot of them are after school programs or lunchtime program, not programs that are built into our school curriculum. And so, thinking about how we can make those things universal, I think is really important.
Also making those programs repeatable, not just you're exposed to it when you're in grade 4 or 5 and then you never hear of it ever again. But, it keeps coming back when you make the transition to high school, when you make the transition to university and college, and how those different environments those different environments and those different level of school institutions may require more knowledge or more training to understand how you express yourself and how self-aware you should be.
Building off what you said, Ben, imagine even in the workplace, having that room to address if you're stressed with your workload, or what do you need, asking that from your manager, because I imagine a lot of workplace stress can also translate to the family environment as well.
Yeah, and just to take it back a little bit too, you had mentioned, so why is gender-based violence exacerbated by crises? And one of the things that emerged from my research is that there's a lack of a gendered lens to responses to crises. So there's a lack of representation of women involved in those responses, and if it's predominantly men, typically aren't going to be privy to the unique needs of women and children, and that is reflected in how resources are reallocated and such. So that is, if we're talking about policy, you have to make sure there's diversity in policy making as well, and that can help make stronger policies that impact the community.
Fully agree. Yes.
Yeah. So, and then jumping off of that too as well, and then tying this into COVID-19, we know that there's a program called Canadian Emergency Response Benefit, or CERB, which can kind of be classified as a almost universal basic income, which is one of those things that, from a gold standard of policy to level the playing field in terms of economics, that's kind of something that has been floating around for a while, but because of the nature of it tends to be very controversial. So maybe let's talk about, is CERB a good idea to sustain long term? Would that help level the playing field get us closer to equality? We know, for example, throwing this in the mix as well, childcare is a whole huge component of the situation as well. And I know that there's a lot of, concerted effort to keep, women are disproportionately more likely to be essential workers during COVID-19, and then therefore women who need to work during COVID-19 should have a safe place to have their children looked after, and would also then need to be subsidized to do that because it's a disproportionate expense. So from a policy level, this is a good area that we can have policy involvement as well.
One, I think universal childcare is needed on its own, whether or not that's tied to the CERB or not. And it was needed before, and it's needed now. Like if we, like it just in general, like we know that women are disproportionately the ones that are responsible for childcare in the home. And that a lot of times the cost of childcare is something that would keep a woman from working outside the home, because a family might look at, how much a woman can make outside the home versus being in the home. And like, if what you're making outside the home does not equate to the childcare expenses or is equivalent to the childcare expenses, then you might say, well, it's not even worth it for me to work outside the home, right? So just in general, if we want women to be in the workplace and working, like we need to provide them with the supports to make that real. And also provide them, even for women who aren't working, provide them with childcare so they can, get an education or, whatever they need to do to improve themselves in their situation. I think that's, really important on its own. And then as far as the CERB, I feel like it ties a little bit into our minimum wage discussion. This is a bigger discussion, I think, than even just related to gender-based violence. But caregiving women, the idea of a CERB for stay-at-home moms, maybe, to recognize that what they're doing in the home is labor.
You could bring that to the government in your workplace.
I love the idea. I am not confident. But recognizing that there is different types of labor besides what happens in the workplace, I think is really important. And again, like we talked about with the minimum wage, just having access to finances can be really key for helping somebody to leave a relationship. Because then there's another question, if I'm a woman in an abusive relationship and I have children and I choose to leave, now what? Now, what do I do? Now I'm the sole provider for these children. How do I, on one income, can I afford to put them in childcare so I can work? How, that's another complicating factor that would go into, women's decision to leave a relationship or not. So, if we can provide them with the financial support in some way, whether that be through universal access to childcare or some kind of universal basic income to help them to be able to afford childcare, then that could be really helpful for someone in an abusive relationship that has children.
Absolutely, and I think that just goes to show. I think I'm stealing a quote. I can't remember who said it. It was on that Canadian Women Foundation podcast. One of the guests basically said, the undervaluing of care work, which women are overrepresented in care work, is a failure of social policy. So that just goes to show that policy has a huge role to play in addressing gender-based violence from an upstream perspective. And we thank you for sharing your thoughts and knowledge about that side of things. So taking everything into account, if you had to sum up, where do we go from here? And, any final words that you'd want to share moving forward?
Yeah, I have a few things. So I guess one, just generally related to policy, there's just a general need to shift to an upstream focus on preventing gender-based violence and either reallocating or allocating new dollars to that upstream approach. Because in the realm of gender-based violence, historically, the focus and particularly the policy response has been around providing social services and a criminal justice response. And like I talked about earlier, like we know that many instances of gender-based violence never end up in the criminal justice system. So if that is our focus, we are missing a number of cases. And also, you know, it just makes more sense to prevent something from happening in the first place, versus, you know, that would limit harm to the individuals and also, you know, cost to our system if we can keep something from happening in the first place. So I think that is just in general, broadly with our, broadly in terms of a policy focus, like that is the shift that needs to happen. And maybe I'll just say, I don't know how it was with you when you were in grad school learning about public health. I remember being taught in school, like, basically politicians don't like prevention. Like, good luck with that.
I was just gonna say.
And like I taught that in university, and I was like,
right.
ooh, like, we need to work on this, because, you know, prevention is not something that can be done within the scope of a 4 or 5 year election cycle, right? You don't see immediate results from your investment. And so, you know, there's a need to shift our thinking towards more long-term, like, what can we do now that's going to benefit people 10 to 20 years down the road, not just related to gender-based violence, but related to, you know, any issue that we discuss in public health. And so that general shift is needed across all areas. And by doing so, you know, that will benefit addressing gender-based violence for sure.
Absolutely.
So that's
took
one
the words.
thought.
Yeah, I was gonna say that. You took the words out of my mouth. Anyways, continue.
All good. I feel like that's, as you know, somebody who works in public health, that's just like the message I want to like drill into everybody's brain, but it's just so hard to get people to understand that.
Yeah, and you know, just as a pertinent example to that, you know, public health or preventative stuff in terms of infection prevention control is not valued unless you have a pandemic. So why are we going to pump hundreds of millions of dollars and there's no pandemic happening? It's because of public health. So like there's a little, like you mentioned, there's a disconnect there between cause and effect. Almost like the reason this isn't happening is because these preventative measures are in place. And then to have a good prevention measures in place, you have to have a lot of resources allocated up front, and that's something that they seem to be unwilling to do or commit to, which is unfortunate.
Yeah, and maybe it has to be like, I don't know how to make that happen. Maybe it has to be a gradual reallocation of resources, as much as, you know, I want to be the type that's like, let's just tear it all down and do this other thing. But you know, I'm hopeful that is the direction our society will eventually move towards. Especially, you know, I feel like money is a driver of a lot of policy decisions, and, you know, helping those in charge to see that, like, in the long run, this is going to save you money, is a big thing, and maybe not something, you know, maybe something we can do better in the public health space is really emphasizing the costs, because that's one thing I've learned working in government. Like, costs are huge in terms of how decisions are made. So that's something to consider. I guess two other things that I just wanted to leave folks with is just an invitation to learn more and to take action. So just a few learning resources that I would encourage folks to look up. One is the resources that are put together by the Center for Research and Education on Violence Against Women and Children's Learning Network, which is based out of Western University, which I know is where you all went. Yeah. Their resources are awesome. They have, you know, fact sheets on every topic you could think of related to gender-based violence, reports. They do webinars on a regular basis. So I would really encourage people to check out those resources, as well as the resources on the Gender-Based Violence Knowledge Center, which is a searchable database of data and content from across the country that's managed by the federal government. And so individual provinces, like provincial governments, as well as researchers and experts from across the country can basically submit data, reports, whatever it might be, to this central repository of information. So if you want to learn something about gender-based violence, that's also a really good place to start. And then one other thing, and we we didn't really talk about this very much, but I think this is really important. Last year, Reclaiming Power and Place, the final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls, was published. And that is a great resource that all Canadians should become familiar with. And I guess that ties into one of my invitations to take action. So within that report, there are 231 calls for justice. Most of those are targeted towards different levels of government in different sectors. But there are 8 calls for justice that are specifically addressed to all Canadians. And those include things like speaking out against, I can't remember the exact wording, but against, things like racism, homophobia, other problematic attitudes and situations, as well as an invitation to decolonialize by learning the true history of Canada and its Indigenous peoples. And so, if you want to do something to start, I really think looking at those 8 calls for justice for all Canadians is really important, especially because I think, lots of Canadians probably don't even know they're in there and that there's an invitation for the general public to do something. So that's one place to start. And then a couple of other things. I would really encourage people to access training from their local either domestic violence support or sexual assault centers, as well as from their local post-secondary institution, because many institutions offer different types of training, such as bystander intervention training to intervene in a situation of sexual violence to prevent the situation from escalating. And then there's a really great online workshop that I did recently at the Sexual Assault Center of Edmonton on recognizing and responding to sexual violence. So it's just for adults who want to learn more about consent and sexual violence and how to support someone who might be impacted by it. When I did the course, it cost $25. It was like a 3-week online course, and they, it offered basically every month or every other month. So that is something that I'd really encourage people to look up. And then the last thing I thought of, I'm not sure what proportion of your audience are university and college students, but there are a couple of really great initiatives happening across the country to address gender-based violence on post-secondary campuses. One of them is called Courage to Act, which is a national initiative. And they, there are institutions across the country that are involved with that, and they are looking at responding to gender-based violence on campus across the prevention spectrum that we talked about today. And they also have a really great set of informational webinars that are all available online that you can watch. And the other initiative is Impacts, which is based out of McGill, and they are developing a campus climate survey to learn about sexual violence on campus and how students feel safe on campus. And any institution across the country can sign on to participate in that project. And so, I would encourage folks at post-secondary institutions to find out if your institution is involved with Courage to Act and Impacts. And if not, try to get involved, because they're both really great pieces of work that are happening that will hopefully, make a difference to the situation of gender-based violence, specifically on post-secondary campuses. So I know that's a lot of things, but I just think it's really important. I know we had a really high-level discussion about policy, but I think it's important for people to realize that, you as an individual can also take action and do something to prevent gender-based violence. I thought of 2 things that I think are both really important. One, I think if someone comes to you saying that I have experienced gender-based violence in whatever form, the best thing that you can do is to say, I believe you, period, end of sentence. You don't need to, no qualifiers to that sentence. I believe you. And then to work with that person to figure out what they might want to do next. If they want to seek help, if they want to access the criminal justice system, whatever it might be. And then the second thing was, I feel like with the with the push for anti-racism, I've seen a lot of things on the internet about like racism interrupters, things that you can say if somebody makes like a racist comment or a racist joke or whatever. And a lot of those things would apply to sexist comments or sexist jokes, things like that. So things like, that's not okay with me. I find that offensive. What you said wasn't funny. You know, simple, short statements to interrupt that sexist behavior so that it doesn't get perpetuated, because it's, you know, that sexist behavior is one of our root causes of gender-based violence. And I think it's important to emphasize that you can have an influence in your immediate circle of people, even if you're not, you know, having an influence at the institutional level.
To cap it off, what has been your favorite or most rewarding part about your work so far?
Oh,
if you can point to one or several. I know it's probably difficult.
Yeah, that's a great question. I guess the thing that immediately comes to mind, so after my time in India, or I guess while I was there with 3 other students from Simon Fraser University, so Destiny Reflection, let me take a step back. So Destiny Reflection, they work with human trafficking survivors and those at risk of exploitation, and they teach them skills training. And the goal is to provide these women and girls with alternative work opportunities so that they don't end up in the sex trade. And so part of what they do is they teach some of these women and girls how to sew. And they make these really beautiful like handbags and bags for like your yoga mat and different textile products. And so when I was there 10 years ago, one of the biggest challenges that they were facing was trying to get those products to international markets overseas, because the way they operate is they prefer to be able to provide these women with work and to pay them a living wage, as opposed to just accepting charitable donations. Not that they won't, but their preference is to operate as a business and pay these women a living wage so that they can make a decent living. And so while I was there, me and these 3 other students, we wrote a grant application to get $1,000 in seed money to, start an importing business to bring those products into Canada. And so when I returned to Vancouver, this is something that I worked on for, we worked on this for maybe 6 years, where we would bring their products into Canada. We had a few partnerships with the Simon Fraser University bookstore. There was a yoga studio in Vancouver that carried some of their products, as well as just selling them at farmers markets. And then we took all the profit and it was used to purchase more products from them. So we worked on that for several years until like now they're at this Destiny Reflection is at a point where they're more sustainable in their business. And, they have lots of partners all over the world now that sell their products. They're also on Amazon in India, which is really great. And so in the end, we ended up with a small amount of like a few $1,000s left, which we were able to donate back to them, and they used that to buy equipment that they needed. So it was a really small project that, we didn't change the face of human trafficking in India or anywhere. But, we were able to support this organization that is making an impact in the local community in a sustainable way, and in a way that was, led by them based on their preferences for how they want their organization to operate. So that's one little thing that I can think of.
Changing the world one person and one community at a time. That's all we can do. That's an awesome story. Thanks for sharing that.
Thank you.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.